dental department, then you will drive up your revenues by 10, 20%. So we can actually build out financial models for them. And with that, we can provide all the equipment, everything that is needed, even the consumables, upfront, so that you or the healthcare provider can already treat their patients, get paid, and then pay us within a period of 6 months to even 2 years. And we've done that successfully in Eastern Congo, for example, or in rural areas in Rwanda, where we have increased accessibility to quality healthcare by more than 200%. And and then at the same time, not only are we making medical supplies affordable and accessible, but with the data that we have, we can also help policymakers, NGOs, to ensure that healthcare services are being improved, because with the data we can de-risk the medical supply chain through anomaly detection in AI. We can see, if in a certain region there is a 20% increase in a demand for malaria-related products, then that might be a malaria outbreak or a cholera outbreak. Think of northern Burundi, for example, where we also work, and then we can alert healthcare providers in time to be better prepared and to avoid the health crisis. Yeah, so in a nutshell, what we really do is demand prediction through pattern mining, pattern recognition, and then ensuring that hospitals have the right quantities of medical supplies available. And then we're using optimized delivery routes, which is very important, in rural areas. How can you reach the fastest way possible a healthcare provider if you now need urgently medical supplies? And we can help manufacturers also to improve their production. And this is also important here in Kenya, right? We've heard it before. We need to manufacture in Africa. And we want to give market access to manufacturers through the data that we have. So right now we're working, as I mentioned, with 440 healthcare providers. And then we can tell those manufacturers, this is what is needed for the Rwandan market, or for the Congolese market, for the Kenyan market. And through that, they can optimize their production. And with our platform, they actually have direct access to all the healthcare providers. They no longer have to, employ a sales team in each country. So then, the fourth part of our solution is contingency plans. We saw that during COVID-19, when in Rwanda, a landlocked country, suddenly medical supplies were not available. And we've built a huge distribution network throughout the region in East Africa, where now we can get any product from other distributors, from manufacturers within a very short period of time. And with the data that we have, we can build models with machine learning that will actually model out how long it will take to get a product from each country. How long will it take to get it from India? At which specific time, when there is the Chinese New Year, you might not want to order from China. So with all that data, we try to really make the supply chain much more efficient. And then we also want to help hospitals to procure more efficiently and transparently. Because right now, there's unfortunately a lot of corruption going on, with procurement. And with our platform, the hospital management can log in and they see the full, order history. They can follow up on all the orders. We ensure the best prices. So there's no room for corruption here with the procurement process, which then actually saves a lot of money for the hospital, which they can then spend on offering much better health services, on hiring more doctors, having a wider product range. And as I already mentioned, our Viebeg finance part, lack of finance, we heard it before today, is a huge problem here in the region for hospitals, right? Because we need more investments into healthcare. And unfortunately, the hospital to population ratio is very low. I've given example of the dentist to population ratio, which is 1 to 150,000 in Africa, compared to 1 to 2,000 in developed world. And what we really want to do is we want to make modern equipment more affordable through equipment financing, and then, as I said, buy now, pay later terms for consumables. And we're not just a trading company that buys and sells or an Amazon of medical supplies, but we're really, a partner, because so many people rely on the healthcare providers, on you. You can rely on us. So we have after-sales services. We have biomedical engineers that we train, in Kenya, that are sent to Europe, to the US, to China. We do a lot of training sessions with manufacturers, bringing actually experts to each country that we work in to, do trainings on surgery. So we really want to be here to improve healthcare together with the hospitals. Yeah, and now I'd like to hand over to my partner, my co-founder, Alex, who is going to tell you a bit more about our customers and which products we actually offer.
So thank you very much. My name is Alex. I'm the Chief Commercial Officer and the co-founder. I have 13 years experience in the medical industry. One of the key things I would like to mention on our customer portfolio, we have almost 500 clinics and hospitals in Eastern DRC, Rwanda, Burundi. Now we've entered Kenya. As well, we are good partners with Rwanda Medical Supplies, some of the biggest institutions in Rwanda. Now looking forward to enter the Kenyan market. As you mentioned, the main problem is a broken supply chain that we would want to solve. The other thing is I would want to stress is on the platform. We have our tech gurus that can, take you through the procurement agents, ensure that we save a cost to you, on the risk of the product, maybe stolen products, something to do with how we will handle this better. So we have a booth on just the other end where you can visit and probably get to know how much we could save your procurement process. Not forgetting that we also have offices at Babadogo. We have a big warehouse. Currently, our shipments fast consignments are in the way, and we would like to actually work with you. The other thing is, just to contribute on medical tourism, the main topic that you've been discussing, I believe in one thing is, we have to start with why are we doing what we're doing. And if we solve that equation of why are we doing what we're doing, then we will come up with a great solution to the healthcare industry. Why am I saying this? I find each and every person in this industry that we're working in mostly concentrating on how much profits I would earn. But then if you would concentrate with how much impact you would create in the society, then trust me, we will have the best healthcare industry in the East and Central Africa. So thank you very much, and thank you for your time as well.
So thank you so much, Viebeg. So at this particular point, we move to the panel discussion. So I'd like to call the moderator of this session, who's